Hello, my name is Carrie Iocolano, and today we will be sharing a video tutorial on 6 tips to improve your buried continuous intradermal suture pattern for skin closure in dogs and cats. The authors have no conflicts of interest to disclose. The benefits of utilizing the continuous intradermal pattern include reduced incidence of self-inflicted trauma to the healing incision and improved cosmetic appearance of the surgical scar. Furthermore, the intradermal pattern does not require suture removal. Despite its benefits, the intradermal closure may be more time-consuming and challenging to execute compared to alternative skin closure techniques. These tips will address common pitfalls encountered when performing continuous intradermal closure. For the purposes of this demonstration, 3 mutually perpendicular axes will be used to describe relative positions within the incision. The x-axis will outline the length of the incision, the y-axis will describe the depth of the incision, and the z-axis will lie along the width of the incision. Ideal intradermal bites will generally move in 2 planes while remaining fixed in one. Tip number 1. Needle positioning relative to the incision during intradermal bites can improve dermal apposition. The dermal layer can be visualized either through the use of forceps to tension the subcutaneous tissues away from the dermal layer, or by using your fingers to roll the skin outward. When preparing for an intradermal bite, the needle tip should be positioned parallel to the z-axis such that the needle is on point relative to the dermis. The surgeon should pop the needle into the dermis before rotating their wrist to maximize z-axis depth. The surgeon may need to palm the needle drivers or remove their fingers from the rings to get the necessary needle driver rotation. Unlike rotating the needle through subcutaneous tissue, rotating the needle through the dermal layer should yield some resistance. While the needle must travel along the z-plane and x-plane of the incision, it should not change within the y-plane, such that the dermis remains engaged throughout the length of the bite. Changes in needle trajectory along the y-axis will result in poor dermal apposition secondary to the engagement of subcutaneous tissues. To avoid this, the needle should remain parallel to the skin's surface such that the entry and exit points of the needle occur at the same y-axis level. Tip number 2. Backtracking during intradermal bites combats incomplete dermal apposition. Incomplete dermal apposition can still occur even if the needle always engages the dermal layer. This is often due to subsequent intradermal bites advancing too far along the x-axis with respect to the exit point of the previous bite. When advancing occurs, lengths of dermal tissue are skipped and the suture is unable to oppose those dermal edges. The entry point of the next bite must always consider the exit point of the previous bite. While the ideal entry point of the next bite occurs at the same x-axis level as the exit point of the previous bite, this often results in inadvertent advancing due to unintended progression of the needle in the x-axis prior to entering the dermis. Instead, the authors recommend that the entry point of the next bite backtracks along the x-axis. While this method may result in a squiggled appearance to the incision line, the authors favor this approach over the risk of poor apposition when attempting symmetric x-axis positioning. Tip number 3. Improving superficial to deep bites aids in knot formation depth. To promote appropriate knot depth and subsequent burial, superficial to deep bites should aim to travel as deep as possible along the y-axis. Depth of superficial to deep bites can be improved by initially tunneling along the z-axis before rotating the needle through the y-axis. Similar to performing an intradermal bite, palm the needle driver to position the needle on point relative to the dermis, but perpendicular to the incision as opposed to parallel. Once tunneled in the z-axis, natural wrist rotation following the curvature of the needle should result in appropriate y-axis depth. Movement along the x-axis during this bite may result in less y-axis depth. Therefore, be sure to maintain the perpendicular needle position with respect to the incisional line throughout the bite. Tip number 4. Appropriate knot component orientation improves knot burial. Poorly buried knots negatively impact wound healing due to exposed suture material and inadequate dermal apposition at the ends of the incision. Knot burial can be improved by ensuring the appropriate orientation of your tails, loops, and lines prior to knot tying. Importantly, these knot components must be directly adjacent to each other in the x-axis prior to tying. For the starting knot, knot components are composed of a deep suture line and a deep tail. Both components should be on the same side of the superficial loop. Opposite-facing knot components result in a knot that forms around the superficial loop, impeding knot burial. Ideally, the knot components face towards the center of the incision where incisional depth is greatest. For the finishing knot, knot components are composed of a deep suture loop and a deep line. A common mistake made during the final superficial to deep bite is continuous x-axis progression, resulting in an interloping superficial loop between the knot components. Similar to the starting knot, this positioning results in a knot that forms around the superficial loop, impeding knot burial. Therefore, the needle should slightly backtrack along the x-axis, accepting a slight loss of y-axis depth, such that the knot components are positioned directly adjacent to each other. Tip number 5. Suture tensioning decreases slack and minimizes incisional gaping. Excessive slack within the suture line can lead to incisional gaping, resulting in poor dermal apposition. When taking intradermal bites, minimize slack by maintaining tension throughout the suture line. To prevent an over-tensioned line, press the incision with your finger to relax the skin and distribute the tension evenly throughout the wound. During knot formation, the knot components should be pulled parallel to the length of the incision to further remove slack. This simultaneously maximizes y-axis depth and improves knot burial. Finally, excess slack can also be mistakenly overlooked in the formation of the finishing knot. After the first throw, independently pull each side of the loop to remove remaining slack from the suture line to promote better dermal apposition. This only needs to occur after the first throw to appropriately center the loop. Tip number 6. Engaging the incisional dead space aids in flipping the final knot. A poorly buried finishing knot can be improved by flipping the knot into the dead space deep within the incision. This is accomplished by passing the needle into the empty space immediately adjacent to the knot, and then rotating the needle under the knot and out the skin such that the knot is pulled into the empty space as the line is tensioned. This space is more easily identified by tensioning the suture line in the y-axis, which also helps avoid entrapping adjacent suture material. Resistance met by the needle prior to reaching the dead space, such as subcutaneous or dermal tissue, will impede knot movement before it can reach the dead space and prevents its flipping.